my name is Melissa and I'm from Australian Cosmetic Medicine and I'm one of the nurse injectors here. Today I'd like to talk to you about different wrinkles that can form on your face and the best way to treat them. So one of the most common areas we get asked about is the forehead lines across here and the vertical frown lines. I'll class that all as one area. The definite best way to treat those is with Botox, okay, or anti-wrinkle injections I should say. So any of the anti-wrinkle injections are fine in this area. The only thing we have to be careful of in this area is these lines across here are caused by you raising your eyebrows. I can't raise mine because I have anti-wrinkle injections. Raising your eyebrows, and these muscles are always exerting an upward pressure on your eyebrows. So therefore, if we relax them too much, we can get a drop of the eyebrow. Now this isn't so much of a big deal with men because they have a very horizontal eyebrow anyway, and that gives them that masculine look. But if we try and do that on a female, we don't like it. We like a nice arch in our eyebrow. So that's just one of the things we have to be careful with when we're doing that. So we have to look at where the eyebrow sits naturally and the dose that we use, etc. Doing the ones in here though, very easy because these actually pull the eyebrows down. So when we do these, we tend to get a nice lift of the eyebrow, and most women really like that. If the lines are really deep, we may have to add filler as well, but it's not that advisable. This area here has a lot of vessels in it that lead to the back of the eye, and as many of you would know, one of the side effects of having filler is if we inject some of the filler accidentally into a vessel and it travels throughout the vessel network, similar to a blood clot or something like that, it will block the vessel and block the blood supply to that tissue. Now, if that's the back of your eye, that's not a great thing because it can mean loss of vision. Now, it is very, very, very rare that something like that happens, but this area is probably one of the more risky areas of doing it, so we would prefer to use anti-wrinkle injection rather than fillers where we can. Same with the crow's feet. With the crow's feet, what we find is that anti-wrinkle is the best around here. It only treats the line that goes around your eye though, the muscle, sorry, that goes around your eye and causes those splay out like wrinkles there. Sometimes when people are a little bit disappointed with their result, it's because what's happening is, like me with my big cheeks, the cheek actually can push up as well, and you can find that there's just some lines formed from the cheek. Unfortunately, the cheek is connected to the mouth, and so when the corners of our mouth go up, the cheek bulges out. If we were to put Botox in the cheek to stop those lines coming, what would happen is, one, we wouldn't be able to smile, and two, we may drop them out, and no one wants that to happen. So that's probably only, again, limitation to having Botox or anti-wrinkle around the crow's feet. We can use a very fine filler to actually fill in the crow's feet as well if we're not getting enough from the anti-wrinkle. The other thing sometimes is worth doing is if people have lost volume on the outer cheek, we can fill the outer cheek, and that can help support the skin. And I think you've seen some of my other videos as well. Having dermal therapies to help the structure of the skin can often help as well. The third area that I'll move up to is the temples. This is an area that not many people look at, and it's an area that we do get some bone reabsorption, so we find that it gets quite hollow in there, and we'll actually drop the eyebrow in the corners as well as making you look quite hollow in that area. So what we pop in there is just a simple filler. Again, it is on the more medium dangerous side, so you do want to make sure you go to an experienced practitioner who's been working for a while and knows all the risks, etc., and their anatomy to be doing that area. The next area we move down to is the Nasolabial Fold down here and the marionette line down here. Now, this is a common area we get people come in for. They start saying, I'm looking sad, I'm looking saggy, I'm starting to drop, all those sorts of things. And that's exactly right, you are starting to drop. So what's happening is there's volume loss through here, volume loss back through here, through the jawline, and that's what makes everything fall forward and can cause this line. The other thing that can cause the line, obviously, is a repetitive movement of smiling. Now, obviously, with repetitive movement, wrinkles, we tend to like using anti-wrinkle, but in this area, it's not one we would want to use because we don't want to stop you smiling. We want to still be able to smile and look good, etc. So So our option is to do filler. Now sometimes what we need to do is actually fill in the volume that we've lost in through here before we even start in here, because if you don't address this, this won't look good. So what we tend to do is fill up the cheeks first of where they're lacking any volume, and again, not making you look like a chipmunk or silly when you smile or anything like that. It's purely just putting back the volume that you've lost over the years. Then we tend to address these with a filler. It's the same with here, it's the same thing happening. Again, we need to sort of pull it up and back before we actually address these. Occasionally, if they're just mild, we can sort of fill the shadow with some filler. The other thing that we can do down here is a little bit of anti-wrinkle. You have a muscle attached to the corner of your mouth down here, and it pulls downwards, and then these muscles pull upwards. Over time with gravity, what can happen is this muscle can turn down a bit, and we tend to get that downturn in our mouth. By popping a little bit of anti-wrinkle down here and relaxing that muscle so it doesn't pull downwards anymore, gives these muscles a bit more chance to pull upwards and turns the corner of the mouth up. So that's a little trick with that one. The last area I'm going to address today is the under eye area. This is the one where we get people coming and saying, oh, people keep thinking I look tired all the time. I feel like I look tired all the time, and I'm not. I'm getting plenty of sleep. It's great, you know. So what we can do in there is actually fill in the hollowness, because often what you find is the hollowness is making you look like you have bags under your eyes, which people associate with being tired. So this procedure is a little bit more downtime because the skin around the eyes is very fragile and the eye area is quite sensitive. It's not very painful at all. People think the area around their eyes is going to be painful, and it's not much at all. It's more sensitive, so it does tend to swell. It bruises very easily, those sorts of things. So I always tell people to, you know, give it between 2 and 4 weeks before a special occasion to be doing that area, so that it has a good amount of time to settle. The great thing about that area though is you only usually have to do it every couple of years. It actually lasts a very, very long time. So it's good bang for your buck. And I have forgotten one. I almost forgot the little fine lines across here. Up until recently, these were very difficult to treat. We could use fillers, but the fillers that we were using weren't thin enough, and the really thin fillers were only lasting a couple of months. And it's, you know, it is a sensitive area to do. The good thing is we can do what's called a dental block, so make the area all numb like at the dentist, or we can use just a numbing cream. But now, in the last couple of years, we've got a great product that is really suitable for these lines and gives a really nice effect. It's called the airbrushing product, so it's a nice thin product. It sort of finds its way into the little nooks and crannies and little wrinkles and things, and doesn't give any bulk across there. We used to find that when we were treating those lines across there, what happened was, after a few treatments along the way, what would happen, they'd start looking a little bit bulky across there. And we didn't like that look, it didn't look great. So now we have this amazing product. We can also use some fractionated laser, some plasmage, plasma therapy, etc., to actually strengthen the skin across there, as well as injecting. So there are now quite a few things we can do for those. Just a hint though, these used to be called smoker's lines because it was the action of smoking. Now I call them water bottle lines because not many people smoke anymore. It's very rare to have smokers, and what I find is people are coming into me and saying, I've got these lines but I've never smoked, how can I have smoker's lines? And I ask them, do you drink out of pop-top water bottles? And the answer is nearly always yes. So those pop-top water bottles, when you're sucking on them, it's the same action as smoking. So you're doing a repetitive action across the upper lip. Sometimes we can put a little bit of Botox across there, anti-wrinkle, across there, and that can relax it, but not everybody likes that feeling because it does stop the muscle from moving. It can make you feel like your speech changes or your smile changes. So it's something I usually say, give it a try. Don't do it before you have to make a speech at a wedding or anything like that. And then I probably find about a 50-50 where people come back and say, no, I just really didn't like the feeling and I couldn't get used to it. And then we get the other 50% that say, yep, that was okay, I'm happy to keep going with that. So I hope that's helped you. They're the main areas we get asked about and what we can do to them. So I hope you've enjoyed this video. If you'd like to come in for a consult and discuss what we can do for you, we can jump online and book a consultation at www.wrinklesmelbourne.com, or alternatively you can email us a question or post a question on Facebook. We're happy to answer any questions or queries that people have. And if you've got any other suggestions for any videos that you would like or information that you would like, please just let us know. So hope you're all safe and well, and we'll see you next time. Thanks.